Audio is not shared, Doctor. No audio.
So 4 seasons of Brain Teaser, and this is the second season for the All India PG quiz. With you.
लकी है परफॉर्मेंस की तलवार ऐसी दरिया है ये रिमेंबर कर ले जो डूबे वो ही होता है पार जो भी आए यहाँ पे उसको चांसे मिलती है हर नजर की यहाँ पे सोचो एक मंजिल ही है मौका मिले तो खोना नहीं ये आएगा ना ये बार बार
So good evening once more and welcome all participants and my pranam to all the gurus, that is mentors, who have logged into today's quarterfinals. What a great season 2 has been till now. Massive participation with more than 630 teams logging for the preliminary rounds. 8 preliminary rounds. 3 quiz masters per episode from across the country. What a great science and learning. And of course, the thrill, the adrenaline, the fun. I believe no less than Khatro Ke Khiladi. All the teams performed extremely well, and it was very hard fought. Hardly there was a separation amongst their performances. So a big congratulations to all the 630 teams who participated in the preliminary round. Please mute yourself. Now 80 teams have made it to quarterfinal, and the first set of 20 will play first quarterfinals for today. So welcome team members of the 20 teams and of course their proud mentors. Congratulations. Participants, once more, please note the 20 teams in the quarterfinal will be playing today's quiz with us on Zoom platform as well. Rest of the participants or postgraduates who are not in this quarterfinal should log into the Zoom platform, but record their responses only on Kahoot platform. Once more, let me remind the participants who are beyond 20 quarterfinalists should not answer on the Zoom platform. The postgraduates, remember, you should play beyond the teams who are participating in today's quiz, because you will be eligible for prizes which are meant for comprehensive ophthalmologists per episode, which Dr. Shilpi will be sharing with you in short details. Postgraduates who are not in today's quarterfinal need not get disheartened. There are 60 more teams amongst who will be making it to next 3 quarterfinals. The second set of 20 quarterfinalists who will be playing the second quarterfinal will be announced at the conclusion of today's episode. So what should other teams do? They can participate and play as they have been playing, and they become eligible for prizes per episode. So let's keep learning and have fun. Today, we have 3 quiz masters. Dr. Santosh Kumar Mahapatra, who is a Chief Medical Officer and Vitreoretinal Surgeon par excellence from JPM Rotary Eye Hospital and Research Institute, Cuttack, and a dear friend of mine. He was also a Chairman Scientific Committee for Odisha Ophthalmological Society. Dr. Sumit Lahane, he is an ace oculoplastic surgeon. He is a director of Raghunath Netralaya, Mumbai, and also right now Secretary of Bombay Ophthalmological Society, one of the biggest society after All India Ophthalmological Society. Dr. Dipti Joshi, a famous pediatric ophthalmologist from M.M. Joshi Institute, Hubli. I welcome you all. We are thankful to Mr. Sai Krishnan and his Numeratech for giving an efficient back office for smooth conduct of this online event. We are, of course, thankful to Microlab for their generous support, and I would fail in my duties if I don't specially recognize Mr. Ashok, Executive Vice President, and Mr. Navneet, who have been working really hard to get every student from across the country on this platform. Here is a promo from Microlab. So it's now time for us to move to the format of these quarterfinals. Of course, it has to be different than what the preliminary rounds have been. So I request Dr. Shilpi Narnavre, an ace vitreoretinal surgeon from Nagpur from my institute, to share with you and acclimatize you with the new set of rules for you. Over to you, Shilpi.
Thank you, sir. So welcome back, friends, and welcome to the first quarterfinal episode of Big Q Season 2. So quickly, we'll see what is the format and the rules. So total, we have 4 quarterfinals, to 80 teams, 20 teams per quarterfinal. Today is the first quarterfinal. Second quarterfinal will be on the next Wednesday, that is 8th of March. Teams qualifying for second quarterfinal will be declared by the end of today's episode. So keep playing. For teams who are playing the quarterfinals, you need to log in from 2 platforms, that is Kahoot and Zoom platform, but you need to log in only from one email ID. The first screen is a live quizzing for Zoom platform, because today, out of the 3 rounds, you will play the 2 rounds face to face with the quiz masters, and that is only for the teams who have qualified for the quarterfinals 1. Second screen is the Kahoot platform. This is for the 3rd round, and it is common for both the audience and the teams. For this round, you need to answer and record your response on the Kahoot platform. All the mentors are requested to only join on the Zoom platform from a separate screen. 5 out of 20 teams from each quarterfinal will qualify for the semifinals, which will be declared at the conclusion of the quarterfinal 4. So what is the criteria for qualifying for the semifinals? The respective quarterfinal marks of the team plus the total of the best 4 performances of the preliminary rounds. So now coming to the rules of today's episode. So we have MCQ sets. Each set has 5 questions. It is for both the teams and the audience, which you need to play through Kahoot. There will be no negative marking in this round. The second is case-based questions. It will be only on the Zoom platform with the teams. 3 questions will be asked and you need to answer it in 20 seconds. If you don't know the answer, just say pass. Yes, in this we have the negative marking also. So for correct response, plus 10 will be given, while for the every incorrect, minus 5 will be deducted. And the third round is the rapid fire round, again only for the quarterfinalist team. So there will be 5 questions you need to answer in 30 seconds. Again, there is negative marking for the same round. So finally, you have to follow our decision. So teams which did not qualify for the quarterfinal or which haven't qualified for today's quarterfinal, you can play as an individual on the Kahoot platform as an audience. And so that you can bag the prizes of the audience, that is second runner-up rupees 2,000, first runner-up rupees 3,000, and the winner as rupees 5,000. And attention, all participants, the participation certificates are live now and they are uploaded, so you can download it from this site. So now Sir will introduce our 3 quiz masters.
So Dr. Santosh Mahapatra, again a dear friend of mine, a ace vitreoretinal surgeon who has been trained from Aditya Jyotai Hospital, Mumbai. He has been a vitreoretinal consultant since 2008 and is currently a chief medical officer since 2020 at Rotary Hospital, Cuttack. He has performed more than 12,000 vitreoretinal surgery, and he is also a thesis guide for postgraduates doing DNB at his place. He has 22 papers in his peer-reviewed journal and presented more than 100 papers elsewhere across the state as a guest speaker. Few awards to mention: Best Subject Paper Award in Comprehensive Ophthalmology he got in IIOC 2020, IGO Certificate of Merit Award in 2020, Best Subject Paper in Comprehensive Ophthalmology again in 2021, and BNR Subidu Endowment International Award at a coin in 2021. He has been the PI to various investigations since 2017 on various molecules. He has been chairman scientific committee, one of his major contribution to Odisha State Ophthalmological Society. And with this, I now move on to the introduction of the second quiz master. He is, of course, ever charming Dr. Sumit Lahane. He has done his MS from JJ Hospital, Mumbai, and he has done his FCRS from Narayan Nethralaya, Bangalore, fellowship in ocular oncology and oculoplasty from CFS, Hyderabad. He has worked as an assistant professor at Sir JJ Hospital, Mumbai, and currently he is a director of Raghunath Nethralaya, Mumbai. His basic interest is varied, right from ocular surface tumors to tomography, keratoconus, and most importantly, he has a passion for teaching PGs. Currently, he is owning a important post of being a secretary of Bombay Ophthalmological Society, besides other posts. Welcome, Dr. Sumit. And now, the third quiz master for today is again a smiling lady, that is Dr. Dipti Joshi. She's a pediatric ophthalmologist from MM Joshi Eye Institute, Hubli. She's actively involved in PG teaching activities at her institute since last 8 years. And she has been a recipient of Best Quint Paper Award at AIOS and Best Quint Video Award at World Society of Pediatric Ophthalmology and Strabismus. She has multiple publications in national and international peer-reviewed journal. And beyond ophthalmology, one most important thing is she's enrolled in LIMCA book for world record for training maximum teachers at a stretch about safeguarding children against child sexual abuse. With this, now I request the first quiz master to take over, and it is going to be the MCQ round. And I request Dr. Santosh Mahapatra to continue with it.
Thank you. Thank you, Dr. Prasan. Can we start straight away?
Yes, sir.
Yes, sir.
The first question for the day is: topical medication can be implemented in 45-year-old male who developed rheumatism retinal detachment after using some FDA-approved eye drop for better near vision. And the choices are pilocarpine 1%, pilocarpine 1.25%, pilocarpine 2%, and pilocarpine 1.5%. And your time starts now. Time is over.
Hold on. Yeah,
Yeah, and the answer is pilocarpine 1.25%. As you all know, pilocarpine is a drop which is used to constrict the pupil, and this can be used for correcting near vision, which is already FDA approved. But the percentage is important, and that is 1.25%. We can move on to the next question. Question number 2. What is the most likely advice in this 25-year-old female? Please look at the fundus. The first choice is avoid high velocity spots. Second, intravitreal ranibizumab. Third, systemic evaluation to rule out nematode infection. And fourth is laser. And your time starts now. Yes. Can we go for the answer?
yeah, please go ahead.
So this condition you need to know. These are the radiating lines you can see from the optic disc and their liquor cracks. So this is expected to be seen in high myopia and others, where you need to, there is a chance of retinal detachment if there is a direct high velocity sports contact. So you need to avoid high velocity sports. Next question. Look at the fundus picture. In a 22-year-old male has this lesion in retinal periphery. And what is the next step? Choice 1, observe. Choice 2, MRI brain. Choice C, intravitreal anti-VEGF. And choice D, subtheatral micropulse lesion. And your time starts now. Your time is over. Answer, please. This, as one can see, this is a clear-cut picture of a retinal angioma, and we should think of systemic involvement like von Hippel-Lindau disease, and one should do a MRI of brain to rule out any other site of the lesions, and MRI is the next step. Next question. What is the name of this glaucoma drainage device made in India? Choice A, Ahmed implant. Choice B, AADI. Choice C, original Revlet implant. And choice D, Malteno. And your time starts now. And the answer is AADI, that is annular aqueous drainage implant, and this is made in, by Urban Group, and the clue is there in the question itself, that is made in India. Next question.
Doctor, 1 minute. Can you please hold on? No,
Yes.
team who say that they cannot log in into Kahoot again, if they get an error as the name is already in use, just change the last character. The last character, change it, and you can log in on Kahoot. There is one team in the quarterfinal who's not able to log in. They are posting on the group.
Sai, there is one team from GMC Bhopal, you are, no?
Yeah, GMC Bhopal, please log in on Kahoot. Change the last character. Whatever you used earlier, just don't use that. Change the character.
Change the character. हाँ डाल दीजिए.
GMC Bhopal, you are there.
Shall we move, Sai?
Okay, madam, no response from them.
Yeah. Sir,
Can I move?
Yeah,
Yes.
please.
Please look at the picture and tell me what is the diagnosis. Choice A, eyelid hemangioma. Choice B, orbital lymphangioma. Choice C, retinoblastoma. And choice D, microphthalmos with orbital cyst. And your time starts now. Time is over. Can you go for the answer? It's a microphthalmic eye with orbital cyst. As you can see in the other eye, the size of the eye is very small. And here the swelling you can see in the involving the lower lid is a orbital cyst only in a microphthalmic eye. Thank you. I think we are the first round is over for us.
yes, sir. The first round is over. Sumit, sir.
So Sumit, are you there with us?
Yes, sir, I'm there.
Okay. Now it's our time to invite team number 1 who will be playing the first round of case-based presentation.
Case-based.
Case-based
And rapid
presentation
fire.
and rapid fire round as well. So on team number 1 is team AMU. Can we have team AMU with us? Dr. Saima Shahid and Dr. Pragya. Are you there with us?
So meanwhile, I would like to thank you, Dr. Prashant sir and Dr. Shishir ma'am and everyone for giving me this opportunity.
We'll talk later about that. Let's see. Team AMU, are you there with us? Please unmute yourself and do log in. Join us on the platform. Team AMU. Is it logged in?
Team 1, you can unmute.
Team 1 is team AMU.
Okay, we can move to the another team.
Another team, can we request team
Plexus.
Team Plexus? Can you come on the screen? Are you there with us?
Yes, sir.
Good. So best of luck. Can you just introduce yourself first and tell us about your mentor, and then you will start having your
Both come in same screen.
both of you come on the get your video input also on. Where are you? The other
Yes,
part.
sir. So video is on.
Okay, good. No, this is Team Spark. Team Spark, you have to
So team Plexus.
Rest of the teams, please.
Get your video.
should be off.
Only team which is going to play immediately will get. Yeah.
Team
So
Plexus.
can you introduce yourself for the sake of the viewers over here? Where are you?
Yes, sir.
Please go ahead.
Yes, sir. So I'm Dr. Diksha Sethi, final year postgraduate resident from AIMS Raipur.
Correct.
Sir, I am Dr. Q Mondal from AIMS Raipur, second year postgraduate junior resident.
So congratulations on being there with us for the first quarter final, and you are the opening batsman today. So
Thank you,
now the format is going to be, we will have a case-based presentation where you will have to answer 3 questions within 20 seconds. Remember, if you don't have know the first answer, you can say pass. Otherwise, you have finite 20 seconds and you will miss upon the precious time. And following that, we will have a 5 rapid fire round that will be telling you subsequently, which Dr. Deepti will be taking you through. So over to you, Dr. Sumit.
Yes, sir. So all the best to the team Plexus, and your question
sir.
is here. Saisa, question, please. Yeah. So this is basically a fundus picture. A 70-year-old female presented with the blurring of vision and distorted images since few days. She gives no history of any trauma or any such episode before. History of both eye cataract surgery is done 10 years before. On fundus examination, the following picture is there, and the questions are questions. What diagnose the condition, please?
Epiretinal membrane.
Question number 2. Most common risk factor for the development. See
Pass.
properly near the blood vessel. Question number 3. Can cause multi-level retinal hemorrhages. True or false?
True.
I think your time is up. So here you need to get your first answer correct,
This is
which
the
is retinal artery
diagnosis.
macroaneurysm. Then you will get the second answer correct, which is systemic hypertension. And yes, it is true. It can cause multi-level retinal hemorrhages. So you answered only one. That is wrong. So it is -5 for you. I'm so sorry.
The third they said true, so it is right.
Yes, sir.
Is it true? Okay.
Yes, right.
You score +5. Okay.
Yes, sir. Yes.
I think now you keep on holding there. Now it is time for you to be quizzed for rapid fire round. It will be 30 seconds within which you have to answer 5 questions, maximum of 5 questions. Be fast so that you don't exhaust your
Yes.
time. It is very finite. So Dipti, can you take us through this team for the rapid fire round?
Yes, sir. Sir, am I audible?
Yes.
Yes, to team 1. Your time starts now. Okay. The first question is, what's the diagnosis?
Central retinal artery occlusion without sparing cilioretinal artery occlusion.
Okay.
Sparing cilioretinal artery.
Cilioretinal artery.
Sparing cilioretinal artery. Okay. Number 2, ophthalmic artery is a branch of.
Internal carotid artery.
Artery.
Perfect. Number 3, Amsler Krumig grading is used in which ophthalmic condition? Your time's running up.
Pass.
Number 4, expand DIMS classes. Okay, you had taken it up, so please complete the answer. Expand the DIMS classes, which is used in myopia control.
Pass.
Pass.
Okay, so that was your fifth question. The answer is number 1, diagnosis. That was perfect. That was cilioretinal artery occlusion with the central retinal artery occlusion with cilioretinal arteries pairing. The ophthalmic artery is a branch of internal carotid artery. Again, was correct. Amsler grading is used in keratoconus. DIMS is defocus incorporated multiple segments, and that's the newest glasses which is used for myopia control. I'd given an unscramble to you, and that was retinoblastoma. Congratulations.
So well played, team. And now you can mute yourself as well as get your video off out. Now we will have the second team for playing this case-based presentation, and it is going to be Team Oro Masters. Team Oro Masters, can you unmute yourself and get your video on?
We are on.
Yeah. Please be kind enough to introduce yourself, your team.
We are Team Oro Masters. I'm Dr. Shafina. And I'm Dr. Geetu.
And your mentor, please do tell about them as well.
His name is Pranesh Balasubramanian.
Okay.
They are from Arvind Eye Hospital.
Yeah.
Yeah.
Tell about your institute and which year you are. Come on. Everyone wants to know you.
We are final year DMBs in Arvind Eye Hospital, Coimbatore.
Very good. Congratulations and welcome to quarterfinal 1. And so now I will request Dr. Sumit and then followed by Dr. Deepti to take over to you with the case-based presentation as well as the rapid fire round. Over to you.
Okay, so all the best, team. Your question is, a 47-year-old marathon runner developed a decrease in vision in both eyes since 3 days. There is no history of any systemic illness. He is a liver donor for his sibling. Vision in the right eye is 660, in the left eye is 636. And here is the fundus picture. The questions are: diagnose the condition.
Kushna's retinopathy.
Question number 2, most common causative agent.
Pass.
Question number 3, prominent vitritis and or anterior chamber inflammation is associated with this condition. True or false?
False. False.
That is time up. Please show the answers. So it's basically acute retinal necrosis. That's why we were telling that it's a healthy individual. It could be because of HSV or VZV, varicella zoster, and of course there is a prominent vitritis and anterior chamber inflammation in diseases, which was true. So you made 2 wrong here.
Minus 20 you get. So
Minus 10.
no, minus 10. Minus 10. Sorry, minus 5, minus 5. Now Deepti, over to you for rapid fire round with Oro Masters.
Hello, team 2. So your time starts now. The first question, what sign of thyroid eye disease is being shown here?
Say pass if you're not.
What?
Sorry. You can just pass if you don't know. Your time's running up.
Next, gorgeous.
Second question, fovea centralis is supplied by central retinal artery. True or false?
True.
Third question, Elshing spots are seen in which ophthalmic condition?
Hypertensive retinopathy.
Okay, so your time's up. There were fourth and fifth question. And the answer for that is, the first one is which sign of thyroid eye disease? That is Goldziher sign, that is conjunctival injection. Fovea centralis is supplied by central retinal artery is not true. It's supplied by choroidal vessels. Elshing spots, it was perfectly right. Elshing spots and Segrest streaks are seen in hypertensive retinopathy. So you get one answer right. So over
One
to
wrong.
the,
One
sorry?
wrong, one right, and one pass.
yes, one right, one wrong, one pass. Variety, correct.
Okay, so now
Thank
team
you.
So
three.
well played, team Oro Masters. And now it is time for us to play the rapid fire as well as the case-based presentation with the team 3. And it is Eye Risers. Can you just come on the screen, please? Team Eye Risers. Team Eye Risers. Yeah. Can you just introduce yourself, tell which place you belong to, also about your mentor before we start quizzing you?
Dr. Devu. I'm Dr. Ankita. We are first year primary DNP residents from Arvind Eye Hospital, Coimbatore.
Okay,
Our mentor is Dr. Sangeeta.
very good. Your team mentor has joined in, logged in.
No, I didn't
Okay.
say this.
Okay, we'll be missing him. Okay, now it's, Sumit, over to you with this
Yes.
team forum.
So all the best, eye risers. So see this question. It's a 24-year-old male on routine examination found to have a following retinal picture. Please see this properly. Everything is based on that. Questions is diagnose this condition.
Us.
Most common systemic disease association of this condition. You can see two black colored retinal lesions here. Next.
Us.
Turcot syndrome includes familial adenomatous polyposis, skeletal hematomas, and soft tissue tumors. True or false?
True. Okay.
Answers, please. So this is basically a typical cherpy, and it is most commonly associated with the familial adenomatous polyposis, and it's false. It's basically Gardner syndrome, which has everything, and not the Turcot syndrome.
So now you answered one negative, so you get -5 from this case-based round. Now over to you, Dipti, please.
So
Dr.
welcome to the rapid fire round and your time starts now. Okay, first question. What are the circumferential peripapillary chorioretinal folds known as?
Patterns.
Sorry? Pattern line. Okay. Number 2. What do midget bipolar cells connect?
Pass.
Number 3. What is Ehrlich-Turk's line?
Pass.
Number 4. Transpose +1 diopter sphere +1 diopter cylinder at 40 degree.
Pass.
Pass. Okay. So let's go to the answer.
Amblyopia.
You had
Okay, you told
amblyopia.
amblyopia. Okay. So the pattern folds are correct. They are found in papilledema around the disc. And midget bipolar cells connects the single cone to the single ganglion cells, basically cone to ganglion cell. Ehrlich-Turk line is line of KPs, keratic precipitate seen in uveitis. Transposition, it was +2 and -1 at 130 degree. And you did the unscrambled light, even though the time was over, that was correct. That was amblyopia.
So I think how much you scored from this round?
10.
+10 on in
10.
general. So well played, team.
Thank you.
Thank you for that. So now it's time for us to move to the next team, and it is going to be from team GMC Bhopal. Can I request team GMC Bhopal to come on the screen? Team GMC Bhopal, welcome. Can you please introduce yourself, which year, college, and your as well as you can suggest share the name of your mentor, please.
We are not visible, sir, on the screen.
We can see you. We can see you, dear.
Yes, sir. Dr. Nitin Kushwaha, RSO 3rd year, and Dr. Pankaj Kushwaha,
Dr. Pankaj Sharma, final prop ophthalmologist from Gandhi Medical College.
Our mentor is Dr. Aditi Dubey.
Okay. So welcome team GMC Bhopal. Now I request Dr. Sumit to take over them through the case-based round.
All the best, the team. Your question is, a 25-year-old male presented with the diminution vision in both eyes. History of similar complaints is there in the sibling. And this is a clinical picture on slit lamp. And your questions are, diagnose the condition.
Pass.
Question number 2, most common inheritance pattern of this condition.
Pass.
And question number 3, it's also called as a Fehler's corneal dystrophy. Is it true or false?
False.
Okay. So the answers are, so the easier one, it's a macular corneal dystrophy, which is most commonly inherited as autosomal recessive pattern. And also it's called as a Fehler's corneal dystrophy, which is true. It's not false. So you did one wrong here.
So you get -5 from this round, and over to you, Dipti, for continuing with it.
So team 4, over to you for rapid fire. And your time starts now. First question. Identify the circled ocular condition.
Staphyloma.
Okay. Number 2. I am a star-shaped fibrous cells usually present in nerve fiber and ganglion cell. What am I?
Astrocyte. No, astrocyte.
Astrocytes. Number 3. Where do you find Ferris line?
No, pass.
Number 4. What orientation of prism can correct TISO deviation?
Base out.
Sorry?
Base out. Base out.
Base out. Okay. And that was 5th question unscramble for you.
End of thermitis. End of thermitis.
Okay. Everyone is unscrambling after the time is over. So this is the answer. It was necrotizing scleritis or scleromalacia perforans. That was wrong. Astrocytes was perfectly correct. And number 3, Ferris line is found in filtering bleb. And the 4th one was again correct. That was base out prism. So there were 2 questions which were right. 5th was correct. Unfortunately, the time was over. So thank you.
Correct, 1 wrong. So it is my plus 15.
So now we can have the next team, and it is going to be team IGMC Shimla. Team IGMC Shimla, are you there with us? Can you get your video? Come on, get your video on.
Sir, it is, we have turned it on.
Yes.
Yes. And we are so happy to have Dr. Professor Sharma, also their mentor, proud mentor, to be there. Sir, welcome to the BQ. You can unmute yourself, sir.
Thank you, sir. Thank you. Congratulations to my team, and they have made it. I hope they go further.
No, sir. See, out of 670 teams, they are amongst the 80 who have made into quarterfinals. So they deserve a pat. Otherwise, also, the now rest is all thrill, adrenaline, and luck as well as their knowledge. So thank you for being with us, sir. We will be interacting with you at the conclusion of the quiz. So be with us, sir. You can unmute yourself, and the students will play. Over to you, Sumit, now.
All the best, team IGMC Shimla. Your question is, a 21-year-old male presented with diminution of vision in both eyes. Here you can have a histopatho picture also and a slit lamp picture too. And my questions are, diagnose the condition.
Lattice corneal dystrophy.
Question number 2, deposition of dash is seen in cornea in this dystrophy. Question number 3.
Pass.
Autosomal recessive inheritance is most commonly seen. True or false?
False.
Sorry?
False.
Okay. And the answers are, it's lattice corneal dystrophy. Yes, there is a amyloid deposition, and it's false. It's autosomal dominant in inheritance. So you give 2 correct. So it's plus 20 for you. Well played.
Dipti.
So welcome to the rapid fire, and your time starts now. The first question, identify the corneal dystrophy.
Pass.
Number 2, which important structure does Meckel's cave contain?
Trigeminal of ganglion.
Okay, number 3, what are white lines of Vogt?
Keratoconus will striate the folds, striate folds in the keratoconus.
Okay, number 4, where is anterior focal point in the reduced eye?
14.5.
Where? 14.5?
Keratomalacia.
No. Okay, that was your beyond time question. Okay, so the corneal dystrophy was granular. Your questions were full of corneal dystrophies. So which important structure? That was correct. It was trigeminal ganglion. Vogt's striae is different and white line of Vogt is different. That is sheathed vessels in lattice degeneration. Anterior focal point is 15.7 millimeter in front of anterior surface of cornea. Unscrambling was right, but the time was over. So trigeminal ganglion was correct. Prashant sir, they told 14.5 millimeter. What do I do about that?
You are a pediatric ophthalmologist. You are the quiz master. We will accept it, whatever you say. You will prevail.
They were close to millimeter, but then front of surface of the cornea, where I asked them, I think in front of the cornea, I think we can give them, sir.
Okay, so they
2
get
correct, 2 wrong.
No, 1 passed. 1 passed.
Okay.
So you get 15. Well played, team. And
Now
I think
it's a time for MCQs. Santosh sir.
so. Now teams, remember, again, now we'll be back to MCQ, which all the teams have to play simultaneously. And then we will have the same set for next 5 teams. Okay.
Sir, there was some issue. We had not received the panelist link previously. So we have just received it right now.
Sure.
We will get you in the next round.
Yes.
Don't worry. Okay. So now
Thank you, sir.
I request Dr. Santosh to take over with the MCQ round, second set of MCQs.
Thank you. Can I have my questions? The color of the Facebook page is blue because to contrast with Google, to reduce computer vision syndrome, Facebook CEO has an eye condition, and to taper cleaner to hyperops. And your time starts now. And the time is up. And the answer is Facebook CEO. His name is Luxembourg, has red-green color blindness, and that's why he has chosen blue color and white letters over it. And next question: what is the most likely predisposing factor for this? Diabetes mellitus, hypertension, weightlifting, HIV. And your time starts now. Time is up. This is a boat-shaped hemorrhage, subhyaloid hemorrhage, and the clinical diagnosis is Valsalva retinopathy. And hence, the most likely predisposing factor is weightlifting. Next question. What is the cause of blindness of this singer? Identify him and tell us the cause of blindness. First, congenital cataract. B, glaucoma. C, ROP. D, uveitis. And your time starts now. Time is over. The answer is ROP. His name is Steve Hunter, and he suffered from ROP, but he is a renowned singer later on. Next question. This is a very well-known pattern for the blinds, and he is the person who invented it. And how did he become blind? Options are glaucoma, age-related macular degeneration, sympathetic ophthalmia, and congenital cataract. And your time starts now. Time is up. He is none other than Louis Braille, and you know this is for the blinds, and he became blind due to sympathetic ophthalmia, as he was playing with it and injured one of his eyes, and he became blind due to sympathetic ophthalmia in the other eye. Which musical instrument was he proficient in playing? Options are guitar, harmonium, bagpipe, saxophone. And your time starts now. Time is up. He is none other than Charles Kellman, the famous Paco inventor, and he is a good player of saxophone. Next question.
Sir, with this, we end with the next 5 MCQs.
Okay, we'll go.
So it's now time for us again to go back to the case-based teams.
Yeah.
And so we'll have teams on a Zoom platform, next set of 5 teams. So can we have team AMU now with us? Are you there with us now?
Yes, sir.
Can you get your video on? And
Yes,
can you please do introduce yourself and your mentor as well?
Sir, I am Dr.
mentor,
Simon.
Yeah.
We can't see you.
We want
Yes, ma'am. Just a second. It's
get your video as well as if your mentor, Dr. Syed, are you there with us? You can also get your video on.
sir hasn't received the link to your end.
Kya hua?
Sir hasn't received the link to join till
We
now.
can't hear you. You have to be a bit louder. Come closer to the mic. Otherwise, we will.
Sir hasn't received the link to join. We also
Same link. Better share with him after this round. Okay.
sir.
After this. Now, right now you play. Now I request the Sumit sir to take over this guy. First, let us introduce yourself.
Yes, sir. I am Dr. Saima. And I'm Dr. Pragya. We are third year residents at JNC.
Okay. Your signal is quite weak. Let's hope that it stays with you and we are able to hear you well. Okay. So
Yes,
come
sir.
closer and over to you, Sumit.
So all the best, team. This is your question. A 55-year-old male presented with the growing mass lesion in the right eye since 4 months. It's at conjunctiva as a tip and as a hint. And your questions are: diagnose the condition.
Pass.
What is the most common precursor lesion for this condition? It's conjunctival tumor, just to tell you. Okay, next question.
Nevus.
Two mitotic figures per 10 high power field is a poor prognostic histological activity here. True or false?
True.
Okay, the answers are easy. It was conjunctival melanoma, and the most common is not nevus. Most common precursor lesion is primary acquired melanosis, and it's false poor prognostic, and it's 5 mitotic figure per 10 high power field is the correct answer. So you gave second and third wrong. So it's
Wrong.
-10 for you.
-10, yes. So now it's time for the rapid fire round. So team, be ready. You have 30 seconds. So your time starts now. What is the iris findings known as?
These are iris atrophic.
Trans illumination.
Iris atrophic patches.
Second question, name the two major accessory lacrimal glands.
Pass.
Double ring sign of optic disc is seen in which condition?
Pass. There is negative.
Transpose, what type of astigmatism is this? -2 diopter sphere plus 3 diopter cylinder at 180 degree.
ये तो बता रही है.
Okay.
Okay, pass.
Okay. So your time is over. So let's see the answers. The iris finding is iris transillumination defects. It's right. The two major accessory glands are cross and Wolf rings. The double ring sign is seen in optic disc hypoplasia. This is a type of mixed astigmatism. And the fifth, which you didn't attempt it, was hypermetropia. So you get one right in this round. So now it's time for next team, team 7, that is team DH.
Team DH, are you there with us? So team DH is from Disha Agrawal, Dr. Disha and this from
Dr.
JIPMA.
Hemant and Disha.
Dr. Kasturi madam is their mentor. Dr. Kasturi ma'am is there with you?
Yes,
sir, I'm here.
Yes, ma'am. Please get your video on.
Yes, sir. I'm here.
Yeah. Okay.
Team DH.
So team DH, please introduce yourself first.
We can't hear you.
Unmute yourself better.
Sai, please help.
Hello, can you hear us, sir?
Yes.
Good evening, sir and ma'am. I am Disha Agarwal, final year resident from JIPMA Pondicherry.
Myself, Dr. Hemant, I am also a final year resident from JIPMA, sir.
Okay. So both of you, I remember you. I was with you last week. So
Yes, sir.
welcome. I think this girl is occupying the 3/4 of the screen and you guys throw into
Sorry.
one corner. Is she
Sorry,
always
sir.
that dominating?
Sorry, sir.
No issues. I'm just pulling. And Kasturi madam, again in season 2, you are back with your teams. Proud of you, ma'am. Keep motivating your team. We will be interacting with you subsequently after at the conclusion. Please do stay with us. So over to you, Sumit.
So all the best, team DH. The question for you is here. A 5-year-old male child was brought to ophthalmic OPD by parents with the complaints of diminution of vision in both eyes since early childhood. Parents also gave history that child was diagnosed with some cardiac disorder at some other institute. Given below is the clinical picture, and your questions are: most common cause for this condition, ectopia lentis. Most common cause is
Marfan syndrome.
Question 2. Gene and chromosome affected in the same condition.
Pass.
Question 3. Marfan syndrome is autosomal recessive. True or false?
False.
Okay. So yes, it is Marfan syndrome, and the chromosome 15 fibril in one gene FBN, and Marfan syndrome is autosomal dominant. So that again correct. So you got 2 correct, which is plus 20. Well played.
So now it's
Thank you,
time
sir.
for rapid fire for your team. So be ready. Your time starts now. Name 2 drugs associated with this condition.
Ripasudil and amiodarone.
Functionally, which is the antagonistic muscle of LPS, that is levator palpebrae superioris?
Pass.
Where do we find pseudo von Graeff's sign?
Aberrant regeneration of third nerve.
What is the spherical equivalent of plus 16 ds plus 4 dc at 180 degree?
Plus 18 diopter.
Okay, so you can attempt this, but you will not get the marks. Okay, so time is up. Let's see the answers. Yes, the 2 drugs are amiodarone, chloroquine, indomethacin, or phenothiazine.
Correct.
Yeah, it's correct. The functionally, which is the antagonistic muscle, is orbicularis oculi. Pseudo von Graeff's sign is seen in the aberrant regeneration of third cranial nerve. The spherical equivalent is minus 14, and this was trabeculectomy. So you have 2 correct and 1 wrong. So it comes out to be plus 15. So now it's time for next team. Team 8.
ABC.
ABC.
Can you close the door, please?
Yeah. Team ABC.
Can you get your video on?
Yes. So please introduce.
Evening, sir. I am Priyanka from JIPMA final year resident.
I'm Dr. Shruti, second year resident from JIP.
Okay, and who is your mentor?
Dr. Nirupam, ma'am.
It's me again.
Okay.
Congratulations, ma'am. How many teams will you keep on fielding? Good. Well played. So time to over to you, Sumit. This is again a second consecutive team from JIPMA. Over to you.
So all the best, team ABC. It's a 48-year-old female complains of sudden painless diminution of vision in left eye. Sudden in onset associated with the distortion of images. Patient gives no history of similar episode in past. No history of any chronic systemic illness. On examination, vision in the left eye is finger counting 3 meter. Rest anterior segment is normal. Fundus photo is shown below, and your questions are: most common cause for this condition.
Neuroretinitis, the most common cause is TB.
Common cause of bilateral stellate maculopathy.
Hypertension, retinopathy, and neuroretinitis.
Cat scratch disease neuroretinitis is more common in females. True or false?
False. False.
Okay, and the answers are: so most common cause for the star-shaped retinopathy is basically neuroretinitis, cat scratch disease. Second is, you're correct, is hypertensive retinopathy for bilateral stellate maculopathy. And cat scratch disease is obviously, it's more common in female than male. It's almost twice common in the female. So well played, but you gave 1 correct, 2 wrong. So that is equal to 0 marks.
Sumit sir?
Yes, ma'am.
First was right. I think they answered neuroretinitis.
But neuroretinitis most common as cat scratch. They said TB.
Okay. Okay. Sure. So team, so get ready for rapid fire round. So your time starts now. Identify the syndrome.
Morning glory syndrome.
Surplus iridis major is formed by the anastomosis of which major arteries?
Long anterior ciliary artery. Anterior ciliary artery.
Amsler sign is seen in which ocular condition?
Fuchs. Fuchs.
What is the angle formed between visual axis and pupillary line?
Kappa, angle kappa.
Unscramble this.
Decoemulsification.
Okay, so let's see the answers. Yes, the first is morning glory syndrome. Circulus iridis major is formed by anterior ciliary artery and two long posterior ciliary arteries. It is correct. Amsler sign is seen in Fuchs heterochromic iridocyclitis. Angle kappa is the angle between visual axis and pupillary line, and it is phacoemulsification. So you gave all 5 answers correct. So plus 50. So congratulations. Now come to the next team, team 9, that is team VBR.
Teams.
Team VBR from Kim's Hospital. Yes.
Yes, come on, girls. Get yourself unmuted. Introduce yourself as well as your mentor.
I'm Dr. Babita, final year PG from King's Bangalore. I'm Dr. Rishita, final year PG from King's Bangalore.
Okay, girls, remember.
Mentor is,
Please go ahead.
our mentor is Dr. Vinita Kulkarni.
Okay, fine. So, has she logged in?
No, sir.
Okay, no issues. Girls, remember your word is quite sound is quite feeble. You have to be a bit louder so that the quiz master hears them right and adequately. Okay. So
Yes,
over
sir.
to you, Sumit, with this.
So all the best, team. Please go through the pictures properly. It's 48-year-old female complains of sudden onset painless diminution of vision in left eye and associated with the distortion of sir, I think
Yeah, any problem, Sumit?
No, sir, no. I'll go ahead with this. No history of chronic systemic illness. An examination of the left eye vision is found to be finger counting 3 meter. Fundus photo is shown below. Show their questions.
Last time's question. Is it angle precision?
I'm not able to hear you. No, this is not a fundus image. Go ahead with the, this is a cornea image. Go ahead with the same thing. It's a gonio finding along with the cornea. This is the, hello. And I'm not able to hear them.
No, we could. Can you be a bit louder?
Team VBR.
Team VBR, have you lost us?
Sir.
Hello, sir.
Yeah,
Yes.
now we can hear you.
Angle recession glaucoma, sir.
Okay.
Okay. Common complication.
Pass.
Okay. Third question.
It has rubella oligoclonal antibody sample in the aqueous humor very rarely in the condition that we are discussing. If you see properly, there are multiple fine dots which are shown on cornea. The angle is shown and the color of the iris is shown. Do you want to rethink about your answer for the third question?
Sir, already the time is over. So I think we should reveal the answers.
Fine. So it's basically Fuchs heterochronic iridocyclitis. Common complication of this disease is secondary glaucoma. You can see the different color iris here, and rubella oligoclonal antibodies are not rare, but they're ample in the aqueous sample. So the third is false. So they answered one, which was wrong.
Okay.
The
Yes.
rest they passed.
Yes. So now it's rapid fire round. Please be closer to the mic and loud. Team.
Okay, sir.
We can't hear you.
Okay, ma'am.
Yes. So your
Hello.
time starts now. What is the highlighted sign known
Ma'am,
as?
are we audible, ma'am?
Yes. What is the highlighted sign known as?
You can pass it on if you don't know.
Team. Team VBR.
Pass. Pass.
Posterior end of which ocular muscle insertion lies near macula?
Pass.
Your time is over.
Candleback, sir. Dripping. Sarcoidosis. Third one is sarcoidosis.
See, you have exhausted your
What type
finite
of image?
30
Inverted
seconds.
image.
Listen, one way you only, and we could consider only your first two questions because we had told you it was 30 seconds. So you exhausted with just for the sake of completion, we are showing you.
The
So
answers.
Vitrectomy.
no,
Listen, you have exhausted your 30 seconds and you only attempted two questions and you passed them. So no marks for this round. So for the sake of the viewers, the answers are the highlighted sign shown is pearl necklace sign. The posterior end of inferior oblique insertion lies near the macula. Candlewax dripping sign is seen in sarcoidosis. Type of image formed by indirect ophthalmoscope is real and inverted. And the unscrambled word is the vitrectomy. So with this, we invite the next team, that is team 10 Oculus Reparo. Team VBR, please unmute.
Yeah, hello. Are we audible? Yeah, are we audible?
Yeah, but we can't see you.
Get your video on.
Turned on the video.
Let me have a look. Santosh, can you get
Yeah.
please. Introduce yourself as well as the mentor, please.
Yeah, I am Neet Mehta, and my along with me is Dr. Prapti. Both of us are third year PGs from LV Prasad, Hyderabad. And with us, our mentor is Dr. Gaura.
Okay.
Has he logged in?
Dr. Gaura, are you there with us?
Yes. Good evening, Dr. Prashant.
Can you get your video on?
I have put my video on.
Okay, welcome, ma'am. Welcome. It's we are so happy that and privileged to have you with us as a mentor there. Yeah, we are, and you must be definitely proud of the team which is representing you as you as a mentor.
Yeah,
So,
definitely. They always make us proud.
So please stay with us, ma'am. We will be interacting with you at the conclusion of the thing. So
Sure.
now it's time for us to play the case-based round. So Sumit, sir, and Sumit, request you to be a bit louder.
Okay, sir. So all the best, team. The question for you is 55-year-old male complains of increasing size of a mass lesion in the left eye since 1 year. No history of ocular trauma, no history of any ocular surgery done. Clinical picture is shown below. And your questions are: which virus is known to cause this lesion?
HPV.
Question number 2. Invasive variety of this lesion is treated with?
Pass.
Question number 3. ASOCT shows hyporeflective epithelium at
False.
the site
False.
of lesion.
False.
Okay, and the answers are: it's ocular surface squamous neoplasia caused commonly by HPV. Invasive is treated with excision with plaque brachytherapy, and ASOCT shows hyperreflective epithelium and not hypo, so that is false. So correct, you got 2 correct. Well played. It's plus 20 for you.
Yes. So now be ready for the rapid fire round. So your time starts now. Identify the investigation being performed.
Mebography.
Which is the yoke muscle of right superior rectus.
Left inferior oblique.
Beer track lesion. Name any 2 methods to assess ACA
Gradient and
ratio.
heterophoria method.
Gradient method, heterophoria method.
Unscramble.
Retinoblastoma.
Yes. So the answers are, yes, it is mebography. Yoke muscle is left inferior oblique. The beer track appearance is seen in chirp. Any 2 methods are lens gradient and heterophoria method. And the unscrambled word is retinoblastoma. So you get all 5 correct. Congratulations. So now again, it's time for the MCQ round. Santosh sir?
Yes, I'm here.
Yes. Sorry. So this is the time for the...
Yeah, so this is a sponsored thing, Microlab. So courtesy Microlab. So this will be an advertisement. Thank you, Microlabs, for being with us. So in dry ice, Lubrex. It really gives you a soothing feel like a ice cube. Thank you, Microlabs. So now request Santosh to carry forward with the third set of MCQ round.
Yes.
All the teams have to play it now.
Audience and teams both.
So the question is, which of the following does not fall under the authorship criteria of a manuscript as per the ICMJ? First, substantial contribution to the conception or design of the work, acquisition, analysis, or interpretation of data. B, drafting or revising it critically for important intellectual content. C, affiliated with the original institute of work. D, final approval of the version to be published. And your time starts now. Time is over. As you all know, the authorship criteria is very much well clear-cut. They have concepted it, and it includes substantial contribution, drafting or revising the manuscript, and also the final approval. The author may or may not be affiliated to the original institute of work, but still can be author. So the answer C is the correct answer. The next question is, which of the muscles is most likely to get involved in thyroid eye disease? Choice A, inferior rectus. Choice B, medial rectus. Choice C, superior rectus. And choice D, lateral rectus. And your time starts now. Time is up. And the answer is inferior rectus. As you all know, you can remember the mnemonic, I am so lucky. First and the most common is inferior rectus, followed by medial rectus, followed by superior rectus, and last one is to be involved is lateral rectus. The answer is inferior rectus, choice A. Next question, which is having the best prognosis? This picture A or picture B, picture C or D. This is in case of a diabetic macular edema. And your time starts now. Time is up. Can you have the answer? Choice D. It is because you can see the foveal contour is nearly maintained. There is parallelism, that means all the layers are parallel to each other. There is no disruption in IS-OS junction, and the RP layer is fully intact. So it gives us the best prognosis. Other pictures had cystoid edema, loss of parallelism, or loss of IS-OS junction. Can I have the next question? Question number 14. Which is the first eye hospital of Asia? Choice 1, Igmore Eye Hospital. Choice B, Singapore National Eye Center. Choice C, RPC AIMS New Delhi. And choice D, Sitapur Eye Hospital. And your time starts now. Thank you. And the answer is Igmore. As most of us don't know, India hosted to be the proud country to have the first eye hospital of Asia, that is Igmore, Chennai in 1819. And Singapore National Eye Hospital started in 1990, RPC AIMS in 1956, and Sitapur Eye Hospital in 1926. So Igmore followed by Sitapur. Next question is, which of the following is or are the WHO collaborating center or centers for prevention of blindness? Choice A, Arvind Eye Hospital, Madurai. Choice B, AIMS Delhi. Choice C, LVP Hyderabad. Choice D, All of you. Your time starts now. Time is up. This is easiest of the lot, and all the above hospitals are WHO collaborating centers for prevention of blindness. Next question.
We end with the next
Five.
five
Yes.
MCQs. So now next 5 teams will play. So team 11 is Pizza
Pizza
Pie.
Pie. So Pizza Pie is from Little Flower Hospital, Angamali. So do we have Little Flower team with us? And yes, and your mentor, Professor Elizabeth ma'am has logged in.
No.
Can you just unmute yourself?
Yes, sir. We unmute.
Yeah, can you have Professor Elizabeth ma'am has logged in?
No, sir.
Okay, okay, no issues. Come on, introduce yourself a bit.
I am Dr. Rehana, final year resident, LF Hospital.
I am Dr. Vishnupriya, final year resident, Little Flower Hospital, Angamali.
Okay, most welcome. Congratulations on being the quarter finalist. And so now I request Sumit to take them over with the further round. That is going to be the case-based round. Sumit.
So best of luck, Team Pizza Pie, and your question is here. So a 45-year-old female came for routine evaluation with intermittent watering and blurring of vision. Clinical picture is shown below. You can see a specular microscopy, you can see a retroillumination picture and a slit lamp picture. Questions are: diagnosis.
Fuchs endothelial dystrophy.
Basic pathology at the level of endothelium is
Sodium potassium pump.
it is bilateral autosomal dominant condition with a variable penetration. True or false?
True.
Okay. And the answer,
True, sir.
so you see it properly. It's not Fuchs. It's basically posterior polymorphous corneal dystrophy. You should have seen the slit lamp picture properly. The basic pathology is metaplasia, endothelial cells getting converted to epithelial. And the last sentence is true. It is bilateral autosomal dominant condition.
So they have 1 correct.
Yeah.
And 2 wrong. So it comes out to be 0. So
yes.
Kiti ma'am.
Hello. Yeah. So over to rapid fire round now. And your time starts now. First question. Child with tennis ball injury, give the complete diagnosis. Look at the picture.
Teardrop sign, madam. Blowout fracture.
Number 2. What is the other name of superior tarsal muscle?
Mullers muscle.
Perfect. Number 3. Flower petal appearance on fundus fluorescein angiography.
After cataract surgery edema.
+1 at 180 degree is with the rule. True or false?
False.
Unscramble.
Okay, so we display the answers.
Okay, so you did tell blowout fracture. We can give the marks to them, but it's basically in children, it is most commonly white-eyed blowout fracture with inferior rectus entrapment. The superior tarsal muscle is right, it's Muller's muscle. So, post-cataract surgery, macular edema, I think cystoid macular edema, and +1 at 180, false, you said. That is also perfectly right. And the last one was nanophthalmos.
So they have they attempted 4 and all 4 are correct.
But correct. Yes, yes.
Okay. So now we move to the next team, team 12, that is Timolol Panthers.
From Minto Hospital.
Yeah. So please introduce.
I am Dr. Niranjan.
Loudly. We can't
hear you.
You're not audible?
No, be louder.
Be louder.
I am Dr. Niranjan. This is Dr. Anup. We are 3rd year postgraduates from Minto Eye Hospital.
Has your mentor logged in?
Yes, sir.
Can we have the mentor, sir? Dr. Ravi? Okay. So, welcome. It's nice to see some male faces during the quiz time. I'm really, it was being odd, totally being hijacked by all the females till now. I'm so happy to see 2 male guys over there. Nice to see. Come on. Best of luck now.
Thank you, sir.
Yeah. So all the best, Team Timolol. A 15-year-old girl brought by parents with the complaints of diminution vision in both eyes. Best corrected visual acuity is right eye 660, left eye 636. No family history of visual loss. Fundus picture is shown below. And the questions are: diagnosis, one of the most common dystrophy. Okay. Question 2. Histopathology shows accumulation of dash pigment at the level of RPE. Question 3. It could be inherited autosomal dominant by mutation in ABCA4 gene on chromosome 1p. True or false?
True.
Okay. And the answers are basically Stargardt disease, and its deposition of nothing but lipofusion, and false is dominant is by ELOVL4 gene mutation and not the ABCA4. ABCA4 will be a recessive mutation. So you tried one, but that was wrong. So -5 for you.
So Deepti ma'am.
So Team Minto, now this is your rapid fire round and your time starts now. Name the field defect and where is the lesion?
Optic chiasma.
What is the primary action of superior oblique muscle? Okay, number 3. Number 3, what is the Reisman sign in thyroid orbitopathy?
Pass.
Okay, number 4, on duochrome test, patient sees red better than green. What is his current refractive status? You can complete the answer. Sorry?
More myopic.
Okay. So this was your 5th question. And the answers are the field defect, okay, optic chiasma, we can take it, but it's basically a junctional scotoma and it is at the junction of optic nerve and chiasma. That is specifically the von Willebrand's knee is what I wanted, but chiasma is okay. What is the primary action? Perfect, that is intorsion. Reisman sign is audible bruit over the closed lid. Duochrome test, this was also correct. Patient is currently myopic. Your unscramble was easy, it was goniotomy. So I think 1, 2, and 3 right answers.
So well played, Team Minto. Now let's have the next team, and it is going to be from NSCB Medical College. Smart Birds. Come on, Smart Birds, are you there with us?
Yes, sir. Yes, sir.
So introduce yourself, please.
Good evening, sir and ma'am. I'm Dr. Soumya Iyer, 3rd year medical student. I am Dr. Ashwin, second year.
Louder. We can't hear you. You will miss on the points.
I am Dr. Ashwin, second year resident.
Okay. So
Our mentor is Dr. Padmini Varkade.
Madam is there with
Ma'am
you?
has joined. Yes, she has joined.
Padmini madam, can you come or get your video on? Hello. Okay. We'll interact with her later part. Let us play through these rounds right now.
Sumit sir.
Yeah. All the best, Team Smartboards. It's 20-year-old girl brought by parents with the complaints of diminution of vision in both eyes. The refractive error was -9 in the right, -12 in the left. She had multiple lattices all over peripheral retina. She also had a hearing loss and the cardiac wall disease as per the history. A fundus picture is shown below. And the questions are: diagnosis.
Marfan syndrome.
Question 2. This affects collagen 2, collagen 9, collagen 11, basically affects dash ocular structure. Optical empty beaded vitreous is a known feature of this disease. True or false?
False.
Okay. And the answers are? Basically, it's a Stickler syndrome and it majorly affects your vitreous cavity. An optical empty vitreous is very classical feature of this disease and they are known to be high myopic. That's why I had specifically put the refractive error is very high. And the last is true. So you tried answering 2 and they were both wrong. So you get -10. What do you, Dipti ma'am?
Okay, Dr. Sumit, and now we go to the rapid fire round and your time starts now. What is the procedure being performed here? Number 2.
Pass.
Where do preganglionic sympathetic fibers supplying dilator pupillae originate from?
Pass.
Number 3. Sheath line on the lens. Which ocular condition am I talking about?
Pseudo exfoliation syndrome.
Number 4. Can duochrome test be used in colorblind individual? Yes or no?
No.
Number 5. Unscramble.
Okay, time is over. So let's see the answers.
The procedure was basically a transcleral cytophotocoagulation using micropulse diode laser. So preganglionic sympathetic fibers originate from T1. Sheath line on lens is not pseudo exfoliation. That is Horfrost line circle on the lens, and the busy sheath line is seen in pigment dispersion. Duochrome test can be done in colorblind. Go back. It is chromatic aberration, not color blindness. What I'm talking about here. Unscrambling, that was keratoprosthesis. So I think all the 4 answers, none of them is right actually.
So minus 20, I think. Now it's time to move on to the next team. It is Nair Dynamics, Nair Hospital. So can we have Nair Dynamics with us? Yeah, please introduce yourself.
Myself, Dr. Burhanuddin Fakri. I'm third year resident from Nair Hospital. Good.
The second guy.
We can't hear you.
We can't hear you. Hello. Your net is poor. Sumit, can you hear them?
I cannot hear them, sir. I could hear the
Nair
first.
Hospital, please come closer. Nair Dynamics,
Yes.
can you hear
Can
us?
you hear us? Yeah, we can hear you.
Be
Are you
louder
audible?
now. Okay, over to you,
Yeah.
Sumit.
Okay.
All the best, Nair team. And your question is? Question, please. Yeah. 72-year-old male presented with the diminution of vision in both eyes since 8 months. Right eye 624, left eye 612. Is known hypertensive with history of intermittent eye and a brow ache. On examination, he had both eye pseudophakia with neovascularization iris in the right eye and the flare. Fundus shows dilated, non-tortuous blood vessels with multiple blot deep retinal hemorrhages. Fundus picture is shown, and the questions are diagnosis here. I think they have lost their internet. Question 2. ERG with characteristically show. We cannot hear you. Sorry?
Ocular
ischemic. Okay. Question 2 answer. ERG will show reduction in
B waves. B waves. Are we audible?
Oh yeah, now you are. And men are twice more affected than women. True or false?
I think we have to let it go
Yeah.
because
Yeah,
we have
right.
exhausted the time.
So
So
answer is ocular ischemic syndrome. ERG shows a characteristic reduction in A and B waves, and men are twice more affected, which is true. So they answered one correctly. Second was partially correct.
So we can give them 15 marks?
We can give them 15 marks.
Okay. Now over to you, Dipti.
So now we begin with our rapid fire round. Your time starts now. The first question, name the implant which is shown here.
Eyeglass implant.
Okay, number 2. Which component of visual function does V1 blob cells responsible for?
Color vision.
Number 3. Beat ROP studies associated with which drug?
Pass.
Number 4. What is the spherical equivalent of Jackson's cross cylinder?
+1.
Okay, and this was 5th one out of the time now. So the answer is yes. Arcus 2 retinal prosthesis to be perfect, specific. Color vision, correct. And beat ROP is associated with bevacizumab. The spherical equivalent of Jackson's cross cylinder is 0, and that was toxoplasmosis. I think the first and the second questions are right, sir.
Okay.
So now next team, that is team 15, RIO Rohtak team.
Rohtak, team Rohtak, can you get your video on? And their mentor as well, Dr. Manisha.
Hi, Dr. Prashant and Dr. Shilpi. I'm there. I am on audio. And I congratulate both of you for doing a wonderful job. It's nice platform for interaction for all of us. And my team, Dr. Rohan and Dr. Surinder, they are doing wonderful job. Every time they get motivated, and we are so thankful to you. Thank you so much.
Thank you, Manisha. It is the mentors who mold the new generation, and one amongst the proud mentor is naturally you. So now it's time for us to move on with this. I request Sumit to take over the next part, please.
Please unmute.
Arayo,
Mute
please
yourself
unmute
better.
yourself.
Hi,
Yes.
and introduce yourself first.
I am Dr. Rohan, a third year RIU PGIMS.
Good evening, all. I am Dr. Surinder, third year RIU PGIMS doctor.
Okay.
All the best, Rohan and Surinder. Your question is here. A 45-year-old female presented with the complaint diminution vision in both eyes with redness, pain since 6 days. Vision in the right eye 660, left eye 612. It's a known diabetic with history of intermittent red eye. On examination, he had both eyes with the posterior synechiae and multiple iris nodules, cells flare 2+ with keratic precipitate. Fundus was hazy with vitritis, and the fundus picture is shown below. And diagnosis here?
Sarcoidosis.
Question number 2, associated with hilar adenopathy, polyarthritis, and erythema nodosum. It is
Lofgren syndrome.
serum ACE is elevated approximately in 60% of the patient and correlates with the degree of active pulmonary disease. True or false? Okay, your time is up. Answers, please. So it's sarcoid or granulomatous uveitis, which is correct. It's acute sarcoidosis or Lofgren syndrome, again correct. And third, correct. It basically correlates with the degree of active pulmonary disease to monitor the disease activity. So third is true. So you answered 2 and 2 are correct. So plus 20 for you.
We told third true we told, sir.
I could not hear. Prashant sir, you could hear.
Yeah, we give it. Accept it.
Okay, fine.
So you get
Then
plus
we get
30 out of this round. Over to you, Dipti.
So we start your rapid fire round and your time starts now. Name this instrument.
Tonometer.
Pass.
Number 2. What is the tertiary action of inferior oblique? Tertiary.
Abduction.
Number 3. Vertical stress lines on the posterior stroma of Descemet's membrane of cornea is known as surface of Descemet's membrane.
What's try?
Number 4. What is the principle of cardiac acuity test?
Pass.
Number 5. Unscramble. You
Uveitis.
still have time.
Uveitis.
Okay. So yes, that's perfect. So the instrument, that's a distometer or vertex meter used to measure the back vertex distance that was shown here clearly. Tertiary action is absolutely correct. It's abduction. Box try is correct. And the cardiac acute principle is vanishing optotypes. Fifth one was again correct, uveitis. So I think 3 answers are correct, sir.
Yes, and 1 is wrong. So 25. So with this, we move to MCQ round 4.
And
Santosh sir.
Santosh sir, over to you. All the teams, please play these rounds, as well as the participants who are not participating in the this 20 teams are out of this 20 teams.
Excuse me, sir.
Beyond 20 teams.
Excuse me, sir.
Yeah.
We just got logged out of Kahoot.
Yeah, same here also.
So same
Yes,
here
sir,
also.
we also.
So many people.
Sai, what is happening? Sai,
I
can you?
think it's timed out, doctor. They can log in again. Just ensure that the last character is changed.
Okay.
We give you 2
The
minutes.
Kahoot is not responding.
Sir, we are trying to log in again, but it's not accepting.
Sai, please do guide them.
So we logged back again.
Yeah.
So everyone has logged in. So let us play.
No, sir, we have not logged in.
Please wait, sir.
Okay,
Sir,
we'll
please
wait for
wait.
4 minutes.
QF hyphen.
Number
07 DH.
632
इसके बाद पहले ये 4.
324 0.
Otherwise, we can continue face to face, sir. Meanwhile, if it all.
Yeah, I think so. We will have the.
That they can do. 5 times.
That can be done. No issues.
Yes, ma'am. Just
Okay, then we do
Santosh
that.
sir, is that okay?
Yes, yes. Please carry on. No issues. You have to save time.
Yeah.
So teams, we have given you time to join to the Kahoot. Meanwhile, we'll continue face to face with the team number 16 to 20.
Yeah. So team number 16 is N Square from RIO. So team N Square, are you there with us? Please get your video on. Team N Square. Are you there with us?
Okay, next team is Team Spark.
Team Spark, come on. That is again from RIO Trivandrum. Yeah. So this is team from?
RIO Trivandrum.
Okay. RIO Trivandrum, please
Spark.
introduce yourself.
Team Spark.
So this is Team Spark.
My name is, yes, sir. Yes,
Huh.
sir. My name is Dr. Ashmita.
And other?
Dr. Sahala.
Better. We can't see your faces. Yeah, come on. Huh.
Dr. Sahala, final year resident
And
from
your-
RIO Trivandrum.
Can we, and your Dr. Anita has joined, your mentor?
No,
Okay.
no, sir.
No issues. Let's play on with the quiz. So over to you, Sumit.
Yeah. So all the best, Team Spark. The question for you is here. 60-year-old female developed herpes zoster keratitis and taken treatment for the same. 3 months later, patient presented with the decreased vision and the redness. Clinical picture is attached here with. And your questions are: dash staging is used in this disease.
Pass, sir.
Question number 2. Dash is the recent surgical treatment for the disease. This involves nerve transplant.
Neurotization.
Okay. Question 3. Hyperplastic epithelium with the red peg formation, stromal scarring, destruction or disruption of Bowman membrane is seen in histopathology. True or false?
True.
Okay.
True.
And answers are: this is Mackey's classification, which is used for the neurotropic keratitis. Corneal neurotization is correct answer, and histopathological features are correctly shown. So you said 2, second and third is given correct. So plus 20 for that. First you pass. Well played.
Deepti
What
ma'am?
do you, Deepti ma'am?
So over to rapid fire round and your time starts now. Name any one FFA pattern which is seen in this condition.
Smokestack pattern.
So, smokestack pattern. What's Henry's
Outer
layer?
plexiform layer. Outer plexiform layer.
What mode of inheritance is Leber's
Mitochondrial inheritance. Mitochondrial
Okay.
inheritance.
Number 4. What is logmar decimal of 6 by 60? Decimal.
Pass.
Number 5. Answer.
Strabismus.
Perfect. So now the answers. Yes, smokestack pattern is correct. It was CSR. Henley's layer is thickened outer plexiform layer. That is perfectly correct. Mitochondrial inheritance in LHON is correct. And logmar decibel of 6 by 60 is 1. Strabismus, that is perfectly correct. I think 4 answers are correct. The 5th one, the pass.
So the next team is Dr. Keratomes, and that is from Sankarai Hospital. Can we have the team there? Dr. Aishwarya, Dr. Gagandeep, get your video on. Yeah, please introduce yourself.
Good evening, ma'am.
Introduce yourself. Yeah, we can hear you.
Yes, sir. Myself, Dr. Aishwarya Kadam from Shankarai Hospital, Coimbatore.
Dr. Gagandeep Singh, final year DMD from Shankara Coimbatore.
Do we have your mentor, Dr. Anup Kumar, with us?
Yes.
Yes, sir.
Anup Kumar,
Yes.
sir, where are you?
Yeah, hi, sir. Hi. Yeah,
Can we
good
have
to
your
hear.
video on? Hi,
Yeah,
sir.
yeah.
Welcome. How does it feel
Hi,
to
thank
have
you.
a team which has made into quarterfinal as a mentor?
Yeah, thank you, sir.
Okay.
Yeah.
Be with us, sir. We'll let the team play. Thank you for being with
Yeah.
us. Over
Yeah,
to you,
thanks.
Sumit.
So best of luck, Team Keratomes, and your question is here. So it's 60-year-old female developed herpes zoster keratit. The question is wrong. So let's see the clinical picture and go ahead with the questions directly. Basically, patient presented with the astigmatism and the blurring of vision. And questions here are: questions, please. Dash layer is absent or degenerated in this type of a disease.
Woman's layer.
Okay. It is more common-ish dash gender.
Female gender.
It induces with the rule astigmatism with vertical steepening. True or false? Time up. Answers. So Bowman's correct. It's Terrian marginal degeneration we are talking about. It is more common in males, 3:1, not females, and it induces with the rule. No, it's other way around. So the third one is false. So you answered one correct, one wrong. So it's 5 marks for you.
Deepti ma'am.
So now we start your rapid fire round and your time starts now. Name the surgical technique which is shown here. Hint, it is a ptosis surgery. Okay. Number 2. Where are third order neurons of visual pathway situated in?
You can say pass. if you don't know. Okay.
Number 3. What is the other name of superior orbital fissure syndrome? That will be your last question. I'll just give it out to you.
Pass.
Okay. So these were your other 2 questions. That was in a partly what you answered after the pass was correct. It is tarsoconjunctival muellerectomy, that is Fastener Servat procedure. And the third order neurons are situated in LGB. And the other name of superior orbital fissure syndrome is Roshan-Duvignac syndrome. 20/40, 6/12, and keratoplasty was your other question.
So how much marks do they get?
None, sir. Actually, they didn't answer anything.
Okay.
Okay. So 0.
0. Okay. Let's move on to the next team. And it is again from
Chashme Badur.
Chashme Badur. And it is from RIO Sitapur. Can we have Dr. Anupam and Dr. Nidhi to join us?
Good evening, sir.
Yeah. And your mentor is there with you, Dr. Indranil?
Yes, sir. Dr. Indranil sir.
Indranil ji, kahan ho?
Good evening, sir. Thank you for having us over.
Thank you. Thank you, Indranil. It is so nice as a mentor. You're staying back for your students so late. I'm thankful to you, and it is privileged to host you with us. We will be
I'm
interacting with you
proud
subsequently.
that my students have been able to come up to this forum.
Yes.
And thank you, sir, for you and your team for conducting such a wonderful event, sir. Thank you, sir.
Thank you, Indranil.
I'm sorry I'm on audio because we are facing a little network issue.
Okay.
Thank you, sir.
Thank you. So let's over to the team. Come on, let's play with the Sumit.
Yes, sir. So all the best, team. The question for you is here. 40-year-old male present with the recurrent redness in both eyes since 1 year. He also has acneiform skin lesions which are on and off. He has history of recurrent oral ulcers for which he is on treatment. Clinical picture attached is herewith. And the questions are: diagnosis?
The Behçet syndrome.
Question number 2. --HLA is positive in such cases.
HLA B5.
It is more severe in elderly individual than young population. True or false?
False.
Okay. And the answers are: you're correct, it's Behçet syndrome. It's HLA B51. Okay. And it's more common in elderly. The last sentence is false. So you answered first correctly. Second one you said HLA B5, which is not correct. And third you said false or true?
False, they said.
The false.
So it's 20 minus 5. So 15 for them.
Okay, sir. Deepti ma'am.
Over the rapid and your starts now. Question is, so name the characteristic of
nystagmus.
Okay. Number 2, what is the shortest ocular muscle?
Pass.
Okay. Number 3, flying saucer sign on OCT is which drug toxicity?
Pass.
Number 4, what is the reduction factor for retinoscopy at 2/3 meter and atropine cycloplegia? So we give this question to you.
1.3.
Okay, the last question was this, so which you couldn't attempt. So that is perfectly right. Seesaw nystagmus, because it is pituitary tumor, especially in bipolar hemianopia. The shortest is inferior oblique. The OCT flying saucer sign is seen in HCQ, and the reduction factor of 2/3 meter at atropine is 2.5, and scrambling was pseudophakia to you. 2 questions are correct, sir.
Okay, okay. Thank you. So now it's time for team number 20, that is Dr.
Team 19, that is Dr. Poonam's team from PGI NER Chandigarh.
Yeah, can you get your video on? Dr. Poonam? Dr. Poonam?
Okay, N Square team.
N
are you
Square
there?
team, are you there with us? Okay, so I think we will come to the MCQ round. We are missing upon this team. So we'll request go back to the let us screen share, repeat screen share now.
All of you could log in now again to the Kahoot.
No, ma'am.
Why?
It's not.
Doctor, 1 minute. Doctor, 1 minute. There is one team who's logged in right now.
Which team?
No, to the Kahoot platform or Zoom? Sai?
Zoom problem. On Zoom, doctor. I mean, I help them join, but I don't think so. They understand how to do it.
Okay.
No, what about the Kahoot now?
Are we ready?
Sir, it is coming like you will be able to join soon. Get ready, but it's not showing proper platform. Like
If you see a pause symbol, it means that it is waiting for the next question to be displayed. Are you seeing a pause symbol?
yes, sir. Yes, sir.
Yes, sir.
Then you're logged in.
Yes, sir. Okay, sir.
Okay, thank you.
So shall we start?
Yes, I think.
Santosh?
Okay.
Yes, yes, I am ready. I am just waiting for the size signal.
Please.
Yeah.
Go ahead.
So we'll come back to the round 4 of MCQ. Can I have the questions? Question number 16. Which of the following does not pass through tendinous ring of superior orbital fissure? Choice A, oculomotor nerve. Choice B, nasociliary nerve. Choice C, abducent nerve. And choice D, trochlear nerve. And your time starts now. Time is up. And the answer is trochlear, as you need to memorize the superior orbital fissure with the tendinous ring. All the above structures pass through A, B, C through the tendinous ring, but trochlear nerve is outside below it. The answer is D. Next question. Which of the following does not develop from the surface ectoderm? Choice A, lens. Choice B, ciliary body epithelium. Choice C, corneal epithelium. And choice D, conjunctival epithelium. And the time starts now. Time is up. And the answer is ciliary body epithelium, which develops from neuroectoderm. All other structures like lens, corneal epithelium, and conjunctival epithelium develop from surface ectoderm. Next question. Question number 18. Which of the following structures does not form the medial wall of the orbit? Choice A, sphenoid bone. Choice B, frontal bone. Choice C, lacrimal bone. And choice D, maxillary bone. The time starts now. And the answer is frontal bone. As you might be remembering, the orbital wall is formed by 2, 2, 3, and 4 bones, starting with the superior, then lateral, inferior, and your medial one. So the frontal bone is the answer. Next, MCQ number 19. The following extraocular muscle can perform insertion of the globe. Choice A, superior rectus. Choice B, inferior rectus. Choice C, inferior oblique. And choice D, medial rectus. And the time starts now. And the answer is supervectors. It has already been discussed during the quiz, supervectors can perform intersection. Number 20, which is true about Fresnel prisms? Choice A, single piece of prism. Choice B, are usually made up of polyvinyl chloride. Choice C, reduce visual acuity mainly through light scattering at the group edge and are usually applied to the front of the patient's glass. And the time starts now. And the answer is choice B, are usually made of polyvinyl chloride. As you know, it is not a single piece of prism, it is multiple prisms fixed over the frame and reduce visual acuity mainly through light scattering. And usually it is not the other choices which fit it. So this ends the MCQ round. Over to
Dr. Santosh, thank you for taking us through the final round of MCQ round. So friends, this was the conclusion of all the questions of quarterfinal 1. And so now it's time for us to interact with the mentors who have logged in today. So I request all the mentors to please do log in. We will have a small chat till we have a leaderboard. Remember, today the leaderboard is going to be just a display. Teams which are going to make into the semi-finals will be displayed at the conclusion of all the 4 quarterfinal rounds. So it would be the way we will be going. So
that means only the marks will be displayed today.
No, not marks exactly. We will be letting the who are going topping, because we have to add the marks which have been assumed or which they have got it during the preliminary rounds, plus this will be topping up, and then we will be developing a leaderboard at the conclusion of all 4 quarterfinals. So well played, teams. Thank you, Dr. Dipti, once more, and Sumit, who is again a family member to us as a team of Brain Teasers gang, and Santosh as a new entrant. It was a great show. So we have mentors with us. Professor Sharma sir, your team played extremely well. We are really happy to have that. What was your experience? I think last year also your team was there, correct? You can unmute yourself, sir. Sharma sir, you can.
Yes. Thank you very much, sir. You are really nice, conducting it very, very nicely, beautifully. And lots of difficult situations were there. I really found it, all the answers were really of quite depth and in ophthalmology. My team is performing well. That's something good. More important than this is at the all India level, you are really bringing up the people together, raising the level of the knowledge of ophthalmology, which our ophthalmologists across the world, they are performing extremely well. I hope that we keep this pace at the world level, the coming up ophthalmologist, all the students, they were really performing well. And some of the students who did not perform, actually the situations were very, very difficult for them. And that's what my experience is.
Thank you, Sharma sir. Basically, the students, if we compare to our
Your video.
Sorry. Sometimes the students have some difficulty level. Some of them have, there is some component of luck to it, but we have seen to it to the maximum extent, the level of the difficulty is maintained at all levels. All our quiz masters made a wonderful effort towards it. Yeah, we have again Professor Kasturi Madam from JIPMER, who heads the JIPMER Institute there. Every time she fields 2 or 3 teams and who really reach up to semi-finals, finals, ma'am. This is second season. How do you you have been with us in the first season also. Do you feel there is any difference compared to the last season?
Yes, sir, it's a pleasure to join the quiz program every time. And you have the right mix of questions which test not only the knowledge, but also the clinical application and also their mental ability with that unscrambling and all. So I feel it keeps the enthusiasm of the students also high, so that they have to also brush up their aptitudes in all aspects. So very interesting questions, sir. And I feel it's definitely going better and better. You're including more teams and more participants, giving more opportunities. And like sir had mentioned, it's a good platform because students will know their level and they can also come up to the level of the other teams. So it's really wonderful, sir. Thank you so much.
Thank you, madam. Thank you. I think we have other mentors also with us. Yes, boss. Unmute yourself. Unmute yourself.
Yeah,
Please.
hi, sir.
Yeah.
Yeah, sir. I'm Dr. Anub. I'm from medical internal fellow from Changara, Coimbatore, sir. So it's nice interacting with you, and quiz was also nice. It was little hard luck for my my juniors today. I think it was little. I think little questions were difficult. Few questions, but I think they managed it well.
No, see, out of 80 teams, 40 teams will be making it into the semi-finals, and it will be also their past performances which we will be doing. So we have made it a point that 20 semi-finals. So remember, we have tried to make it a equal difficulty level, but they have whatever their previous performances will be also considered while making it out. So don't worry, don't dishearten. You are a typical mentor who feels for your team so badly. I love your commitment for that. Thank you, Dr. Anup, for staying with your team and backing them till so late. We have other team mentors with us. Yes. Hello. I think I'm missing upon few of the team. Yeah. Sai, can we have other mentors? Yes. Madam Chatan Pawar ma'am, please, Gaura madam, please unmute yourself.
Yes, I have unmuted. So this is a great initiative, and my residents have been doing really well. So I'm very proud of them, both Neet and Prapti. So it keeps them motivated and keeps them enthusiastic towards the subject, like what the other mentors said, like it's not just the knowledge, but their aptitude, their precision, and the time management. I think it's developing them as a whole. So it's really a great thing, so that all the residents across the nation are interacting and they're getting to know you and they're getting to be mentored by the mentors of your mentors. So I think it's a great thing what your team is doing.
Thank
and
you,
I'm
madam.
glad that I'm able to be a part of it today. I'm sorry I couldn't join the previous sessions, but I hope I'll be joining the next ones too. I did learn a lot of things today.
Every one of us is in a learning phase. If you look at it, ma'am, we are all enjoying it. In fact, it is more of a learning for our team rather than for the students. I don't know how much they gain, but definitely we after the age of 50, we are learning like this. Indirectly, that helps me in becoming more wiser, at least ophthalmology wise. Rest way, whether I'm getting wiser or I'm getting insane, I don't know with age. That is a different issue. I think Sharma sir is laughing at me.
I think you're getting younger with the age and more wiser with the knowledge.
Thank you for
very,
those
very rightly said, sir.
So thank you once more. I think we have some other mentors with us. I'm not able to see them in the frame now. So I think we
have gone for dinner probably.
I think so. Very few could be persistent like you standing. Yes. This
Hello,
is
Dr. Prashant.
हाँ जी, आप कहाँ थे सर? कैसे हैं?
Well, I missed down on the last sessions.
No issues.
Sorry, it was for some reason or other.
No, I can understand.
Well, today you called up personally. Thank you very much for having me here. And it is such a
you should thank your students, sir. They are the reason why you are today here with us, not me.
Yeah. Thank you very much. Yeah, it's really feel good and proud that they reached up so far. Yeah. So And I hope you're coming to Aligarh
Yes, I'm
next.
looking
To
forward to
this.
meeting you
Yeah,
now this
yeah,
weekend.
sure.
Chalo, thank you.
Thank you. Nice talking to you.
Can we have a request all that now all the quiz masters to join us for a last bye-bye? Dipti, Sumit, I think we will be displaying the leaderboard in a following mails. So, and the next 20 teams, we will be intimating you on the mails as well as on the various WhatsApp group. So once more, it is time for us to say bye-bye from this first round of quarterfinals. It was a great time. We had a great learning, great fun, great adrenaline rush for the students as well as for us. And thank you, mentors, for being with us as well. All the participants who participated today in a big number, you are making our show more popular. More popular than that, it is the quiz masters. It's the effort of Dr. Santosh, Dr. Deepthi, Dr. Sumit, who have found out wonderful questions to keep you entertained well as educating. So thank you once more, the whole team. Also at the last, I would thank the micro labs as well as Sai and his numeratic team who is taking care of the back-end office as well as the financial part of is being taken care by micro labs. So thank you once more. We will be meeting for second round of quarterfinals on the coming Wednesday. That is going to be the 8th March. Till then, bye-bye. It's time for us to say bye-bye, everyone. Thank you all the mentors once more. We'll look forward to your team participation into the next rounds. Thank you. Thank you once more. Thank you.
Hello, everyone.